Okay, so what I want to do now is just give you a little bit of highlights from the last year, where we've been, what we've accomplished, and where we're going. And really the story begins with 3 identical surgical procedures. Matt Bell, who put our summit together, and thank you Matt for the great work, myself, and Paul Keckley all had knee surgery to repair torn menisci in December. And we all 3 had very different outcomes. It's just reinforced how much I resent young people because while I was still hobbling along on crutches and everything, Matt was bragging about his recovery and the fact that he was getting ready to hit the slopes. I only took solace in the fact that there was very little snow, so there. I have continued to improve, and it's the best thing I've done, and now I'm back to my full exercise and activity and almost essentially pain-free, so I've had a great outcome. And then Paul Keckley, who many of you remember was our keynote speaker last year and got you very engaged. He had the surgery too, but unfortunately developed a deep venous thrombosis, a blood clot. And in fact, that's the reason that he wasn't able to be here. He was scheduled to be our speaker this year, but with a blood clot, you can't travel that long in an airplane. So we called him and said, you know, he graciously offered to be video conferenced in. I just don't think that works real well for a meeting like this. So he said, you know, let's work on coming up with another speaker, and together our work has led to us making lemonade out of these lemons. We have got a real treat for you this afternoon. So let's start with recapping where we've come from last year. Last year, I decided that when we began a program for improving the health of our own employees called the Healthy You, which I'll talk a little bit more about, and that we were taking a very proactive stand to try to encourage health of our employees, a very significant population of patients we take care of, since we're now over 10,000 employees, that we were going to encourage positive habits and behaviors and promotion of health. And so I immediately thought about the fact that I'm the leader of this organization, and if I'm going to be out there telling our employees that they need to improve their health, that I needed to start as a role model. As we looked at our employees mirror the population exactly. We're not better than that. We have 1/3 normal weight, 1/3 overweight, 1/3 obese. And unfortunately I was in the latter category, so I decided that I needed to set a good example. So today I'm 63.5 pounds lighter than I was when I was with you last year, and now, unbelievably to me, exercising every day. But I've always said exercise will kill you, and so I did pay the price of having my torn meniscus, but frankly a very small price to pay for improving my health and extending my life expectancy. But the other great thing about this is that it gave me the unique opportunity as the leader of this organization to actually experience things from our patient's point of view. And so it was a very interesting experience. I am even more proud of what we do and the people that do the work, both our physicians and our staff, and I'll share a little bit about that. But during my recuperation, it did give me a chance to reflect a little bit about how are we progressing? How are we as a health system coming along in our strategy to deliver accountable care which we define as basically the triple aim, a concept that actually Dr. Don Berwick came up with in his role at the Institute for Healthcare Improvement. The triple aim being better health, better care, and lower costs. So we said that better health starts with us. And in fact, we just talked about the fact that it's really hard for an obese caregiver to have the conversation with a patient about what they ought to be doing, because the patients don't hear it. They see that and they don't think it's credible. And so it's got to start with ourselves. Plus, we said, why should anybody else trust us to improve their health if we can't improve our own health? So we launched the Healthy You, and this initiative has already led to some spectacular results. I want to just highlight a couple things. One is, I was in the emergency room waiting on a family member that was being checked, and the security guard came up to me and he said, "I just want to thank you for the Healthy You program." And I said, "Why is that?" And he said that he had been trying to quit smoking for 25 years, never been successful, and now he has quit smoking. And so he attributed us with actually saving his life. And then yesterday, I was putting together a presentation that I'm working on for Monday, and not infrequently I have IT challenges. And so we asked Tracy from IT if he could come over and help me with what was wrong with my laptop. And as typical, it was something pretty trivial, and so I felt very embarrassed. But the great thing was that I got to talk to Tracy for a little bit, and what I found out is he said, St. Luke's has saved his life twice. And I said, "Well, tell me about that." He said the first thing was that at age 5, he was discovered to have coarctation of the aorta, and he was having some significant difficulties related to that. So we did the surgical correction of that at St. Luke's Hospital. So he attributed us with saving his life. In fact, he was so grateful, and the care made such an impact to him, even at that age, that he told his parents as he was growing up, "I'm going to work for St. Luke's one day." And he said, "It took me 9 years. I kept on applying for 9 years until I could get a job with St. Luke's, and I'm so proud I now work for St. Luke's." And I said, "Well, so what's the second time?" And he said, "The second time that we saved his life was during our health screening for the Healthy You program. He got his blood sugar checked and discovered that he was a diabetic, and he didn't know it. So since then, he has lost 110 pounds. And his diabetes was gone in 3 months. And back to my comments about, we have to keep in mind, we're not just impacting patients, we're impacting families. Because of his efforts to improve his health, his wife lost 60 pounds. And now they both work out at the gym together. So he was just going on and on about how grateful he was. And it doesn't end with these couple of stories. For example, in our IT department alone, we have 10 individuals who have lost more than 100 pounds. That's a half a ton of weight loss in 10 individuals. It's amazing. So we're doing great things, and what is so exciting about this is that, frankly, what scares me the most about the triple aim is the better health. How are we going to do that? Because none of the incentives today reward directly caregivers trying to improve the health of people. And yet it is so critical that we figure this out if we're really going to get a control of healthcare costs. And what I'm excited is it looks like we're beginning to figure this out. And we're going to learn a lot from this, and we're going to get better. But the results so far have shown that we've reduced tobacco use among employees by 10%. We have reduced hypertension, pre-hypertension, diabetes, and prediabetes, each one of those by more than 10% in our own employee population. And 91% of our employees chose to participate in the program. So this is significant because this is how we can start in providing accountable care to our own employees. Additionally, when we have this kind of track record, this is something we can take to employers and say, we can help you manage your healthcare costs. And it's not just their direct costs, because studies have shown that for every dollar that an employer spends on healthcare costs, they lose about $2.30 on employee productivity. So we can give them double benefit. So this is very, very exciting, and I'm very proud of where we've gone. I'm also very proud of the fact that we have received a lot of national attention recently. And I want to be clear, my objective is not for us to accumulate trophies. I'm not trying to say, let's have a big trophy case and look at how great we are. That's not it at all. The reason this is so significant is that healthcare organizations across the country tend to think they're much better than they really are. And you know, I've met a lot of leaders of other health systems and hospitals, and not one of them have told me that their hospital or health system is mediocre. Not one of them. They all tend to think they're among the best. And we need to make sure that we're never being overly self-congratulatory. We have to be realistic. In fact, we have to change our attitude to say, when we see an area where we're not performing well, thank you, because this is now an identified opportunity for us to improve. And that's what we're about. We're improving. We're not perfect. It's going to be a long time before we're perfect, if ever. We've got to look for those opportunities to improve. But because that's what we've been doing, we're getting results. And many of you remember that I commented that when I was first asked about would I apply for this job, that I checked out the St. Luke's Health System from Houston. And I did research with health grades, I did research on the CMS compare side, I looked for all the publicly available data, and there's more than you would think. And what I found out is, before I ever came here, is that there is wide variation of quality among our hospitals. That we had some hospitals that we'd have one hospital that might be best performing in the state for a particular condition, and another hospital in our health system that was the worst performing. But even for that hospital that was best performing in this particular condition, in another condition, that hospital that was worst might be outperforming them. So we had inconsistency among our hospitals and even within our hospitals. And that's unacceptable, because I can't sleep at night knowing that somebody's outcome depends on which St. Luke's door they go through. That's not right. So for the last 2 years, 2.5 years, we have been working to systematize our quality efforts, to make sure that we do it across the health system. And it's paying off. And it's not just by our own self-congratulations, this is by objective measures by external bodies. So we took, for example, we said, let's take a high mortality condition. We took sepsis, bloodstream infections. And by working on this as a system, last year we saved 31 lives statistically, because we lowered the rate of mortality. And you might say, well, gosh, we're a huge health system, 31 lives, that seems like a lot of work for not much benefit. But just imagine if you were one of those 31 people, or if you were part of the family of those 31 people. It is very significant, and it shows what we can do. Not only that, Thomson Reuters recognized us as one of the top 50 health systems in the country, and it's based upon mortality, complication rates, patient safety, core measures, readmission rates, length of stay, and patient satisfaction scores. These are the very things that we've been trying to work on, and so this is a great testament to all of your work. In addition, I was very, very pleased that the Boise and Meridian Medical Centers were recognized by Healthgrades as a distinguished hospital of clinical excellence. That means that for the quality measures, they were ranked in the top 5% in the country. That's more than 5,000 hospitals. That means only 1 in about 267 hospitals gets this designation. So that's real progress. We've got a lot further to go. We've got lots of things to do, but I congratulate you all. We're making great strides. We also talked about last year that we were going to launch our Center for Accountable Care. That we weren't just going to talk about accountable care, we were going to actually demonstrate it and show our commitment to it. So we launched that center, and I asked Dr. Jeff Swanson, our Medical Director for Clinical Integration, and Mike Reno, our Vice President for Performance Improvement, to work together to get this Accountable Care Center going. And so we've already begun to do some things. One of the things that I'm very excited about is that we have entered into an agreement with Regents, the Blue Shield plan here, to manage patients at high risk. So these are the patients who are very high cost, lots of medical problems, and they keep on interacting with our health system through frequent admissions or frequently coming into the emergency room. They're high utilizers and high cost. And so what we are doing, and this is a great initial step for accountable care, is we're saying we're identifying the top 450 patients, and then we are going to come up with this year individualized care plans for every one of them. And we're going to help manage that. So that's a great start. And so when you think about it, we've already made great progress starting up with our employees. We've entered into this care of patients at high risk program, so we've done that. Now we are working our way towards participation in the Medicare Shared Savings Program. And this is so that we now will start providing accountable care for the Medicare population. And this is a population that is very ripe for trying to better manage their care, better coordinate care, better manage transitions of care. And I've talked to you before about the challenges that we have of being a very fragmented healthcare delivery system, just like all delivery systems. For example, I've given you the example about when a patient gets discharged from the hospital. They were discharged from the hospital today. They got their discharge instructions, they got their discharge prescriptions, they were wheeled down in a wheelchair, they were put in the car, we closed the car door, we're done. And that's because that's how the payment system is. We get paid for these various episodes of care. But the problem is, with a lot of the Medicare patients and a lot of the other populations, their medical illness doesn't end when they got discharged. And we've got to figure out a way to care for these patients throughout the terms of their illness, regardless of where they are, whether they're in the hospital, whether they're at home, whether they're in another facility. And so we talked about for a long time, went through a very extensive analysis as to whether we should participate in the Medicare Shared Savings Program, and we elected to do so. Why? Because first of all, it's got a lot of structure to it. We have to meet 33 different quality metrics. And the good thing is, our previous quality efforts have been mostly focused on the hospital side, because that's where the monitoring and incentives are. This now gets us into the realm of measuring quality, particularly on the outpatient side. I think if Samantha, I don't know where Samantha Collier is, but she could tell us, I think it's only 2 of those 33 measures are related to actual hospital care itself. So this is a good move. Additionally, one of the big problems that we all face is, as we're going to move to accountable care, which is trying to provide better value care instead of more volume of care, how do we make up for the losses? It's obviously going to hurt our business when our business is built around volumes. And so the nice thing about the Medicare Shared Savings Program is that it has an inherent business model where if we can meet those quality metrics and lower the cost for the population of Medicare beneficiaries we serve, we get to share in those savings. So that's an important step. So our plan is to submit our application in September for a January 1, 2013 start. And I'm very excited about this, and the reason that we can even talk about doing this is because we have significant physician engagement in this, and I'll talk about that in a minute. We also have to be lowering our costs, and we have to, if we want the cost of healthcare to be less, we have to do everything we can to control our costs. And so I brought Mike Reno here 2 years ago to help us start implementing lean in our health system so that we could reduce variation and get waste out of the health system. And that's been a very successful program. And we've rebranded it for St. Luke's. We call it Teamwork, to emphasize that, you know, we're not doing something that the car industry does, even though they do it. We are doing it, and we're applying it to patient care, and we're getting great results. We've already proven some of the benefits through our centralized laundry and lab. We're saving all the healthcare entities in our system the costs. We've reduced those costs. There's been a lot of work done in pharmacy to reduce costs, but also to increase quality. You can see some very direct quality impact from that. We're applying this across the board to our emergency departments, to our operating rooms, to central sterile processing, to our supply chain, a lot of different areas, and we're going to keep expanding this throughout the whole health system. It is going to help us improve quality and do it at lower costs. We've also been increasing our transparency, and we still have a long way to go, but we are doing well for today. I mean, we've got to do a lot more. I had a CEO that I was talking to from the East Coast who had looked at our website and couldn't believe how transparent we were with so many of our metrics. There's a lot of information that we're sharing. We're going to have to do more. We're going to have to share more data internally as well as externally. But we've also been focused on how do we increase transparency with our internal stakeholders. And so what we heard from our employee survey and our physician survey is that we need to understand more about the strategy. We need to understand more about the thinking of the senior leaders. So we've done a number of things to try to address that. One is we've increased the frequency of my employee and board forums to twice a year. I'll be starting a new set of forums in April and going to all the entities of our health system. In addition, we'll do another set of forums in the fall, and we'll do the state of the system addresses at that time. We've also launched the Channel 1, high definition, short duration video content that we are sending out to the workstations so that employees and physicians can see the information that we've recorded and get updates about the health system. In addition to that, is a personal achievement is that I now tweet. And what's made that even more special is I was so excited after I did my first tweet that I went home and talked to both of my kids and told them I was tweeting, and they both informed me that neither one of them knew how to tweet or anything, and I thought, yes, I've finally beaten them. Further, I launched a blog, and I did that because I wanted a way for those people that wanted more information, kind of responding to those employee and physician surveys, that they want to understand more and they would take the time to look at it, that I would take the time to personally write about our strategy, about our initiatives, about why we're doing things, about what our view of certain things are. And so since we launched this, every week we've been posting a new blog piece that we put considerable effort into because we think that communication is so important. And if all the leaders and all of our physicians and all of our employees read that and understand it, then it will help provide alignment and clarity. And I'm really excited. I keep telling Roya, who helps me with the blog, that my goal is to beat Lady Gaga in the number of followers. That would be my goal. I'm not there yet, but I have had over 10,500 unique people have been reading the blog. And we know because it's also the great thing about it is we can have dialogue. People can send in their comments and questions. And we know we've got employees, we've had physicians, we've even had some of the local CEOs around here and talk about transparency. We had a long discussion for a while, you know, should we keep this blog password protected and just internally, or should we make it available to everybody? We said, let's make it available to everybody. And so we've got CEOs of other companies that are reading it. And in fact, even the Statesman's picked up on some of the blog posts and run it in the paper. So we're being more transparent. Additionally, we've been really trying to promote social media because we understand that we can't any longer reach everyone with one particular communication modality. It just doesn't work. Much to my dismay, my kids don't even read a newspaper. And so you're never going to reach some of those folks if it's newspaper advertising or that kind of thing. So we've got to use other venues, and we're doing social media now. Misty is using social media, the Children's Hospital is, and our health system has separate social media initiatives. So we're trying to get people that way. We do have a lot of opportunities, we know that. One of the things that came out on my blog is after I posted about my experience as a patient, another person wrote in complaining about his costs for his surgery. And did I know what my surgery cost? And the point is that although, if you look at the Dartmouth Atlas, our costs are very low relative in the country. And if you look at premiums, insurance premiums are among the lowest in the country in Idaho. But that's little solace to somebody who can't afford it, and it's still unaffordable for too many people. So we have to figure out ways to reduce costs. We also are going to have to embrace patient-centeredness, and that means start doing things centered on that patient instead of centered on what's for our best convenience and so forth. So what do I mean? Well, one example is when I was going through my procedure, there were a number of times, you know, I had to go in for some pre-op blood work, and I had to have an EKG, I had to have various things done, and every time I did that, I had to re-register. That's not very patient-centered. So we've got to fix that. You know, another thing is, if you look at some of the studies, more than 50% of people that are polled say, I want online scheduling for my appointments. More than half of the people surveyed say they want to be able to email their physician. And I know a few people are cringing and thinking, you know, I'm not going to do that. And I understand. However, somebody is going to do it. And what the data shows is that people are more willing today to make a switch of physicians to get some of those things that they perceive as value to them. So we're going to have to be more patient-centered. A huge initiative that I'm so proud of that we have underway is our implementation of My St. Luke's, our EPIC single electronic medical record across the system, and we're starting with our physicians. And this is going to be very significant because it's going to allow for not only those things if the physician wants to do that, online scheduling, email, and so forth, but it's going to allow patients access to their own records. And they want that. And let me tell you, there's a growing number of patients who actually don't think their medical record is your medical record. They think it's theirs, and they want access to it. And this is going to be a significant competitive advantage to us. One of the things I had to do is to have my annual physical recently, so I went in to see my physician, and so he was going to look up some of the information from my surgery, but he said, well, that's actually in a different system, and then, so he couldn't get all of that. And then for my cancer checkups, I see another specialist, and he couldn't get that information. And so that's not good for if we want to make care seamless and patient-centered. And in fact, it's not safe. We've got to fix that, and we will be fixing that. In addition, I was bemoaning the fact that prior to going in, I wanted to see, because I didn't remember the exact point that I'd seen him last, I wanted to see when was my last appointment and how much weight had I lost since that point in time. And he's not on Epic, so I couldn't access my own records. So these are going to be very important initiatives, and fortunately my doctor will be on in April, so that's great. We've also established the Center for Healthcare Innovation. And you may be looking at this slide wondering what are these parentheses in here about. And it's to emphasize the fact that today what we've got to do is innovate in healthcare. We have to innovate in the way we care for patients, because we're not going to get the costs down enough unless we change the care model. But tomorrow, our focus has got to be on these innovative things to improve health. That's got to be our focus. And it has to be our focus because no matter how bad we think the healthcare crisis is today, it's nothing compared to what's coming. And that's because we have an epidemic of childhood obesity. And give those kids 10, 15, 20 years, and they're going to have unprecedented levels of high blood pressure, high cholesterol, diabetes, heart disease, arthritis, and now we have a lot of data showing the association between obesity and certain types of cancers. Whatever improvements we make in the cost of care of patients today is going to be all exceeded by what the costs of care coming in. We've got to figure out how to prevent some of this stuff because it's so much less costly. So we recruited our Chief Transformation Officer, Tony Tomasic, and we said, you got to help us with the transformation of the care model and the business model. And we're not going to innovate just for innovation's sake. We're not an R&D company. We're going to innovate in a way that drives our triple aim. How do we get to better health, better care, and lower costs? And that's why we partnered him with Dr. Samantha Colliard, because whatever the initiatives he's going to do have to be checked by her is it going to further our triple aim. And it's so important that we innovate, and I've talked about this before, because our biggest competitor is not St. Alphonsus. It may be today, but let me tell you, I don't actually think any of us know who our biggest competitor is because they're planning right now. It could be Walmart. It's going to be some things we haven't even thought about, and they're going to come out with new ways to meet the needs of the patients. And let me just explain what I mean. Just assume for a minute that we were a different industry other than healthcare. We're running some other company. I'm the CEO, you're all my board of directors. And we manufacture something. And what if I told you as the board that the product that we're putting out in the market has very inconsistent quality? What if I told you that that product is actually hurting some people? What if I told you that our customers think that it's not very convenient for them to access our product? And what if I told you that almost every single customer we have thinks our product is too expensive? I think if you were the board of directors, you'd be in an uproar, and probably after firing me, you would say, we have got to fix this. But in healthcare, we've known this, and we haven't done much about it. And we kind of think that we almost don't have to because there's not the same kind of threat that there is in other industries. Let me tell you, I've seen and talked to some of the CEOs of companies that are figuring out how to put us out of business. They're out there. They are trying to come up with things that, using technology, are more convenient for patients, safer, less expensive, and that patients will actually like. We better figure this out. And consumerism is going to be a huge piece of what we're going to be facing because people aren't going to put up with this for a whole lot longer. So what's next? Well, one of our challenges is we're in a brave new world. We're entering into one. We actually have one foot really firmly planted in today's world, which is fee for service, and we're trying to move our other foot to a value system. Pay for value. Pay us for the value we deliver. But making that change is really, really tough. It's very tough. We won't be the first industry to do it, and you can see many examples of industries where they failed to do it, and they just tried to keep riding that horse, and then they got surpassed by somebody else. I mean, just look at what happened to Blockbuster for a great example. So I understand that transition and transformation is scary. It's uncomfortable. And it's tough for all of us and all of my management team. We spend a lot of time talking about this and planning for this. But I think what we have to do is we have to be focused on what can we do today that's going to work no matter what. And I think that while healthcare has defied some of the economic principles, it won't violate all the rules, and that is quality, high quality and lower cost has got to win. There's just no way to conceive that that doesn't eventually win. That's where we've got to focus. How do we keep driving our quality, and how do we lower the cost? We're going to have to do things differently, and we're going to have to be thinking about health, but we're well on our way. And I just want you to think in perspective, when you do get anxious about the change that we're trying to prepare for and actually lead, remember that St. Luke's has already been transformed once. We've already gone through significant change, because today, more than half of the revenue of the health system comes on the outpatient side. That's a big change. There's very few health systems that can tell you that. When I meet with other health system CEOs, they're astonished. They're 10, 20%. We're over half. We're already making the transformation away from being hospital-centric. We're on our way, so keep that in mind. We've got to change the paradigm. As I've already mentioned, we've got to focus on patient-centeredness. Let me give you another example. And this is a shame what we do, and I think we would realize that if we stop to think about it. And I've been guilty of this myself in my own practice. You get a single mom who has a bladder infection and develops it at night. She can't call my office or your office to schedule an appointment until the next morning when our office is open. Then she's got kids to get to school, so she doesn't know whether she's got to get somebody else to take the kids or maybe be there to get the kids when they come home, because she has no idea when she can get seen by the doctor. She has no idea when she does go in how long it's going to take. And it's going to cost her more when she comes into the doctor's office than if we could handle it somewhere else. If we were really patient-centered, I mean, how many of you would book a flight if you had to call and make your reservation like we used to in the old days? I wouldn't. Those companies would be out of business, and that's why none of them do it. In fact, now, if you want to talk to a person, you usually got to pay to talk to someone. You have to do all this stuff online. But the interesting thing is, if she had a family emergency, she could have booked the flight in the middle of the night. But if she has a bladder infection, she can't book an appointment. So we've got to be thinking about that. And we've got to think about, if we really want to lower the cost, do I really need to see her? Yes, there are some cases where I might really see her, but the routine bladder infection, no, I probably don't even need to see her. I could treat her over the phone or through email even. So we've got to be thinking of new ways to be patient-centered. We also have to figure out, and we're on our way, to how do we activate patients to be involved in their health. We have to stop treating patients as recipients of care. I'm the doctor, you're the patient, just do what I said. I'm the one that went to medical school. Here's what you need to do. We've got to stop doing that. We've got to engage patients in their care if we really want to change their health. They've got to feel some ownership in it. And then better yet than even just engaging them, we have to activate them. How do we get someone like me, who struggled many, many times with getting his weight down, to actually start something and do a new program and be successful and lose that weight? How do we get patients to say, I'm going to take control of my health, and doctor, you're going to be my consultant. It's my responsibility, my accountability. And there are ways. There's more and more research coming out about patient activation, and we're going to be incorporating it into our programs. Clinical integration. The way that we get our physicians working together, sharing best practices, sharing protocols and order sets, agreeing to what our standards of practice are going to be, and holding each other accountable, and using the electronic medical record to drive this. How are we going to do that? And we've got to do it. And I've given our team the goal of having that complete by the end of the year. We can do this because we have got physician leadership, and we underestimate just how much physician engagement we've got. I hear many of my fellow CEOs talk about that they just can't do things because the physicians aren't on board. We look at this room, how many physicians we have here. Look at the Clinical Leadership Council meeting that I went to this morning. We have got engaged physicians who want to be a part of leading this change and doing the right thing. And because of that, we're going to be successful. So if you are a medical director or a division medical director here in the audience, would you just stand up so we could recognize you for your leadership? That's why, no matter how hard this is, I am not the least bit doubtful that we'll be successful. It's going to be great. I just want to end now with reinforcing for you one more time. The rest of this today and tomorrow is going to be about the AAA. Better health, better care, lower costs. That's what we're striving for.